Fires and Floods, Impacts on Indigenous Communities in British Columbia, a public health case study presentation by Shara Alibai-Watson. This case study presentation was created on the traditional and unceded territories of the Squamish and Tsleil-Waututh Nations. As a University of Victoria student, I acknowledge and respect the Lekwungen, Songhees, and Esquimalt peoples on whose territory the university stands, and the Lekwungen and Wasanic people whose historical relationships with the land continue to this day. As the global climate changes at an accelerated pace, Canada's climate is changing at twice the average global rate. On Canada's west coast, the impacts of this change have become more pronounced in recent years. A recent report on climate change, which was prepared for the BC Ministry of Health, advises that frequent and intense extreme heat events, wildfires, flooding, drought, and other climate hazards are disrupting the balance between the health of the environment and human health and well-being. The widespread disruption caused by these events have become a matter of public health due to increasing number of health risks they pose for the population of British Columbia. Furthermore, those who are marginalized, Indigenous, or who live in rural parts of the province have a higher risk of exposure to climate hazards. In this case study presentation, we will focus on the impacts of flooding and wildfires on the 200-plus Indigenous communities located on the traditional unceded lands we know as British Columbia. Over the past decade, climate events have disproportionately impacted Indigenous communities, leading to evacuations, displacements from traditional territories, and cultural and mental health impacts. Much of the data shown in this presentation will focus on flood and wildfire-related disruption, but the scope of the presentation is not limited to these two climate events. Ultimately, all of the extreme weather events we are experiencing are connected to one another and to the rising temperatures in Canada. In this presentation, we will look at the relevant epidemiological data, we'll discuss the health equity and social justice issues at play. We'll consider historical, social, and political factors, and we'll provide a high-level look at public health responses and structures needed. Public health professionals and the Government of British Columbia, working alongside Indigenous peoples and the First Nations Health Authority, must expedite programs and funding to address the growing inequities for Indigenous people in the face of a growing climate crisis. We'll discuss what our thoughts are on how we best proceed in that direction. So let's talk some statistics. The 10-year average number of wildfires between 2014 and 2024 in British Columbia was 1,527, of which 40% were caused by humans and 60% were caused by lightning. 2023 was the worst wildfire year on record, with the total number of hectares burned totaling over 2.8 million, and the total cost estimated at $1,094.8 million. Now, available flood data is limited as compared to wildfire data, but water-related climate events are intensifying, and the 2021 major flood event in BC caused over $8.7 billion in damages. Moving on to the epidemiological research, BC spent 2.71 million person days under a mandatory evacuation order for flood or wildfire between 2017 and 2023. A positive correlation was made between mandated evacuation days and communities with larger Indigenous populations, demonstrating that the burden of evacuation is greater on Indigenous people. Between 2010 and 2022, there was approximately 170.8 million person days of exposure to wildfire smoke and extreme heat. Individuals living in rural areas of BC, of which many Indigenous people do, had higher levels of exposure and were more susceptible due to lower adaptive capacity and less access to resources, leaving them less able to mitigate the negative effects. Some further research shows that for Indigenous communities, flooding caused by severe storms and coastal erosion threatens culturally significant places, destabilizes infrastructure, increases health risks, and imposes financial burdens. Wildfires significantly harm health and well-being by spreading dangerous smoke that leads to serious health issues, economic costs, and mental health challenges, particularly affecting vulnerable groups like children and seniors. Indigenous communities are already at a disadvantage, being disproportionately located within close proximity of environmental toxins, placing them at a higher risk of health complications. Summarizing our research, there is something that is just completely undeniable. Wildfires and floods will continue to intensify as a result of climate change, and Indigenous communities in BC will continue to be harmed by the negative effects. This is unless we start to make some significant changes. Let's look at the history. Indigenous populations have resided in British Columbia for thousands of years, and they have had to withstand and adapt to significant shifts in their environment. The spread of infectious disease brought here from Europe through settler colonialism eliminated 90% of the Indigenous population across Canada before the 1920s. From the 1920s to present, the attempted elimination of Indigenous people has continued through public policy created by settlers, and simultaneously, as noted, colonial capitalism has been destroying the environment. The erasure of culture predicated through stolen land, the isolation of communities propagated through the creation of reserves, the mental and physical abuse inflicted through the residential school system, the elimination of identity perpetuated by the 60s scoop, and the incarceration and institutionalization currently taking place to impede Indigenous growth has destroyed entire generations of families. Bringing us to present day and looking at the current socio-political context, the history has resulted in Indigenous communities, on average, having disproportionately lower social determinants of health, and this in turn leaves many especially vulnerable to the impacts of climate change. Wildfires and floods in particular have a particularly substantial impact in that they cause a significant disruption to the local environments where many Indigenous communities are located. The impacts of these climate events disturb the diverse cultures, sophisticated economies, and access to sources of food and medicine. When the natural environment is disrupted or damaged, or communities are displaced because of a wildfire or flood, the health and well-being of Indigenous communities is more affected than non-Indigenous communities. Moving into health equity and social justice issues at play, there are considerable intersections between social justice, health equity, and climate change. So one is when we consider oppression as a social determinant of health, geography is a form of oppression if geographical, socioeconomic, and environmental factors perpetuate harm. So for Indigenous communities who are in close proximity to flood and fire high exposure areas, if they don't have adequate access to resources, this is oppressive. Two, the damage caused by capitalism cannot be offset. The only way to move forward is to do things differently, because the way big business, quote unquote, operates currently is harming the environment and by proxy, the people, in a way that can't be undone. And three, an intersectional perspective is one way to improve the social determinants of health for Indigenous peoples. But this means that for those in positions of privilege, recognizing that how we interact with each other and the environment creates categories of advantage and disadvantage. So, where does public health fit into all of this? Well, public health response and structures to address the disproportionate impact of wildfires and floods in Indigenous communities should consider plans and policy for better health protection, emergency management and damage mitigation and response planning, and improved mandates for protection of the environment. So this is broad, but some of the ways around, or some of the ways to achieve this, is public health officials must continue to advocate for Indigenous sovereignty through recognition of land title and self-determination for health governance and economic decision-making. Access continues to be a barrier, so this needs to be recognized. Lack of access to adequate healthcare, housing, and employment leaves Indigenous people vulnerable during and after wildfire and flood events. Public health frameworks must consider an interdependent approach, working alongside the First Nations Health Authority to facilitate access to healthcare services, equipment, and resources, particularly in rural communities. And creating separation between public health and government. And while controversial, what this does is to achieve improved health and environmental protection, planning requires uninfluenced decision making. So, where does this leave us? Well, the efforts towards reconciliation have only just begun because the deep scars and the significant inequities and the racism and misinformation are still present and will take generations to repair. But time, greed, power, and continued sociopolitical beliefs fueling climate change is also perpetuating the continued oppression of Indigenous communities. The systemic challenges the world is facing is a distraction away from the dangers of climate change and those most impacted by it. But herein lies the most consequential part of the equation. To continue down a path of ignorance, only looking at what's immediately in front of us means ending up at the end of a path that ultimately falls off a cliff. And we as a human race may not be able to get back up that cliff. So, how do we go from here? Well, I'm going to conclude by suggesting that we follow their lead. Indigenous people have been here in British Columbia since time immemorial. Courtois, in her 2022 YouTube video on Indigenous Guardians, quite aptly states, "Our home, our shared beautiful mother, our planet is experiencing ecological turmoil." And she's right. And if anyone can show us the way, despite substantial adversity, Indigenous peoples continue to remain constant in their ways of knowing, their connectivity to Mother Earth, and the intrinsic understanding of interdependence. We can collectively learn and grow from this way of knowing. It is the only way to move forward to achieve equitable health and well-being for Indigenous communities in BC. Thank you.